Everyone, today we are going to discuss the topic abruptio placenta, which is also a part of the antepartum hemorrhage, as there is 30 as the cause of the antepartum hemorrhage. It is first one is the placenta previa, and another one is the abruptio placenta. So first of all, what is abruptio placenta? It is one form of the antepartum hemorrhage where the bleeding occurs due to premature separation of normally situated placenta. Okay, now what are the varieties of it? So first one is the revealed and concealed and mixed. Okay, now what is this revealed? In this, the blood insinuates downwards between the membrane, and in the concealed the blood collects behind the separated placenta. Okay, and in the mixed one some part of the blood collects inside. So what are the incidence part? So it occurs in only one in 200 of deliveries, and it is also a significant cause of the perinatal mortality, which is 15 to 20%, and maternal mortality 2 to 5%. Now let's move on to the risk factors. So in the it occurs in the high birth order, in which the gravida is 5 or above, or if the mother is of advanced age, and poor socioeconomic condition, malnutrition, and smoking is also one of the major cause. Okay, now hypertension in pregnancy, it is the most important predisposing factor. So now let's discuss the mechanism of the placenta separation in the preeclampsia. So in this here, the spasm of the vessels in uteroplacental blood, which is anoxic, which leads to anoxic endothelial damage, and further on it ruptures the vessels. There can be traumatic separation of the placenta, sudden uterine decompression, which means the diminished surface area of the uterus decompresses, or due to the short cord or folic acid deficiency, or a torsion of the uterus. So let's see what is the pathogenesis of it. So depending upon the etiological factors, premature placental separation, it is initiated by the hemorrhage into the decidua bacillus. It may be the degeneration and necrosis of the decidua bacillus as well as the placenta. Now, what is the clinical manifestation of the hemorrhage? Blood may accumulate behind the placenta when it is totally separated from uterine wall except at the margin. Blood may dissect downwards in between the membranes. So now let's see the classification. There are four grade. Okay, grade 0, grade 1, grade 2, grade 3. In grade 0 the clinical features are absent, but in grade 1 there can be vaginal bleeding, and the uterus is also irritable with tenderness. Maternal BP and fibrinogen, it is unaffected, and in grade 2 vaginal bleeding, which can be mild to moderate, and shock is usually absent. Maternal BP and fibrinogen level are also absent. In grade 3 there can be severe bleeding and tenderness. Okay guys, and now let's see the clinical features of it. So mainly the clinical features also are that the first of all, the character of the bleeding in the revealed, it is the continuous dark color, and in general condition there can be blood loss. Shock is usually absent in the revealed, but in the mixed part shock may be pronounced, which is out of the proportion to the visible blood loss. And pallor is also related to the blood loss. And features of the preeclampsia, it is usually absent or frequent. Okay, now what are the clinical features basically depends on the separation degree of separation of the placenta, or the and the speed at which the separation occurs, and the amount of blood concealed. Now what are the complications of it? The complication is the shock, hemorrhage, blood coagulation disorder, oliguria, and anuria. Okay, if we discuss the prognosis of the mother and the baby depends on the clinical types. Okay, the degree of the placenta separation, the interval between the separation of the placenta and delivery of the baby, and the efficacy of the treatment. Okay guys, now if we see the management, how to manage or the prevention part, first of all let's see the what the prevention aims at. It aims at the elimination of the known factors likely to produce placental separation, and the correction of the anemia is also important, and prompt the detection and the institution of the therapy to minimize the grave complication, namely like shock, blood coagulation disorder. Okay, and for treatment part, first of all, assessment of the case. It is like the amount of how much the blood loss, the maturity of the fetus, whether the patient is in labor or not, and what are the emergency measures of it. So first of all, the emergency measures are the infusion, IV infusion of crystalloids, blood transfusion, periodic coagulation profile, and fetal monitoring. You can also refer this flowchart. In this, there is the scheme of management of the abruption placenta. Okay. So here the emergency measure as we discussed. Okay, now the general and abdominal examination is to be done. Fetal status, the grade of abruption, the hemoglobin percentage, hematocrit, and the coagulation profile. ABO and RH grouping is also done. Okay, now the following the resuscitation. So first classify it into the revealed or the concealed. Okay, in the revealed part, the patient in the labor, okay, and the patient is not in labor. The patient in labor will be having the vaginal delivery following by the ARM plus oxytocin is given or not. But the patient, if the patient is not in labor, then the delivery is with the ARM continuing with the oxytocin or the cesarean delivery. Okay, and in the concealed part, the delivery is carried out also with the ARM with the oxytocin, or the cesarean delivery and the vaginal delivery in the selected case. Okay guys, and the expected management in the placental abruption, it is an exception, not the rule. Okay, and betamethasone, it is given to accelerate the fetal lung maturity. Okay, this is one of the most important point also. Okay, thank you guys.